So the current burden of disease for chronic disease is actually rising. And it's rising because age is a major risk factor for chronic disease. When it comes to diabetes, so there's something else that has increased in our society, is the rate of obesity. And so that increased rate of obesity is actually accompanied by an increased burden of pre-diabetes and diabetes. Right now, healthcare is delivered within healthcare system, and patients only spend about 10% of their time within the system, and those are really sick patients. Most of the time they spend is where they live, where they work, where they grow, and where they school. I think the major piece of the puzzle that I'm missing is that what underlies most chronic disease is lifestyle behaviors. When you have psychological behaviors, or when you have stress, or you have anxiety, they are intricately woven within those behaviors. Because if we don't address those factors, we can't address those behaviors. If we don't address those behaviors, we're going to have a really hard time in making a dent in improving outcomes in patients with chronic disease.
I don't think there's anything else on the market that addresses the factors that Silver Fern does, and certainly not in the same way. I do think there are companies that try to tackle it from an AI perspective. I do think there's a lot of people who caught on to phrases like whole person care or social determinants of health. But as far as getting at that level beneath that, where it's talk and as opposed to getting to really know the patient, no, I've not seen a tool that gets at that. And I think in part, that takes a little bit of work.
We conducted a series of studies, NIH-funded randomized controlled trials, where we tested this clinical toolset. We're calling it behavior diagnostic. And we tested it in community health centers, diabetes clinics, and obesity clinics. And the idea was in the research to develop and test this new digital health version of this behavior diagnostic. So we wanted to get that tool set into the hands of clinicians, and we wanted to have a digital tool set that could work at scale in the marketplace. There's three things that we principally do. One is the assessment. The second is the set of clinical suggested actions, which are really practical suggested actions for the clinician that would help them most effectively manage right down to each specific thing that's flagged. And so we built this extensive network of suggested actions to support the clinician, and these can pop up in their workflows along with the reporting and the alerts. So the three pieces are the assessment, the suggested actions, and the data visualization with the dashboards. Those three come together to support the clinicians to be effective.
Patients with chronic diseases like diabetes need to know how, when, and why to take their medications, and it's quite important to help decrease the progression of those disease states and increase their quality of life, quite frankly. We're not meeting patient needs with our standard guidelines now because we treat the disease. We don't necessarily treat the patient, and we are seeing more and more that if we address the patient as a whole, we get better results. What I think is unique about the Silver Fern tool in the marketplace today is that it's really easy to administer and it's really easy to use both for the patient and the care team. The questions are easy, it's short, and then the guidance that's provided is in-depth and very useful. It's very innovative in the marketplace today.
The care management team, both clinicians and health coaches, change their practice by asking Silver Fern questions first before they ask clinical questions. They found they could uncover some crucial barriers initially that helped them so much moving forward. We have found for some patients and participants that there's a cascade of benefits. Commonly, it starts with one small success where we unlock a key to weight loss, and it leads to confidence and motivation so that they can succeed in many areas of their life.
If you look at the reimbursement model that we have today, it's all about efficiency, it's all about value, and it's focused at the population level. So what that means is that you've got to have a very good sense of where your patient population is at when it comes to those behavior changes. If I know that as a healthcare provider or a healthcare organization, I would want to appreciate then how to create strategies to address the population health status of that. So what Silver Fern is doing is collecting that data.
I was diagnosed a long time ago, and I think the future of diabetes care should focus more on whole person care and to integrate both the psychosocial dynamics as well as the nutritional dynamics as well as the physical dynamics. And I think a focus that combines those is very, very important for the future. And Silver Fern does that.
epidemic chronic conditions are not medical problems, they are culture and lifestyle related problems. And so we need to kind of step back and understand the profound change in the way we live. So the whole healthcare system has to pivot and really look upstream and start thinking about how they can change the way we live in our environment. What we can do with this tool set is unlock the issues and then help the system to direct the patient to the people that they need and to the information and support services that they need in a very specific way. But we can work on this sort of large digital ecosystem, including there are a lot of digital health companies that can come into the healthcare organization and provide support and services that fold into it. So we start to have an ecosystem that's resonating where the Silver Fern unlocks data, we get patients the help they want, and we drive change.